Hi, I'm Dr. Rahman, and welcome to Black Women's Health Podcast. Thank you for giving me space and grace during the recent loss of my mother. And I want to say, I'm back. Women's health has really exploded. It's now considered more than just reproductive and gynecological issues. Women's health has become a broad term to include mental health changes or medical conditions or concerns that are of concern to women, that are more prevalent in women, that have different manifestations in women, and not just maternal and gynecological health. And that's good. That's a good thing. But what happens? What happens when we talk so much about the other things that we stop talking about maternal morbidity and mortality? When we stop focusing on uterine fibroids and polycystic ovarian syndrome and endometriosis, because the definition of women's health has become so expansive. And what do we do now that it's no longer in vogue to talk about those conditions that disproportionately affect Black women or women of color? How do we address those needs? How do we give women options and solutions that are practical and not just a new procedure and a new pharmaceutical? How can we look at holistic options to offer women choice in how they manage their health care? This becomes a really interesting question at a time when women's health, women's reproductive rights seems to be of interest, of concern to a lot of people. And my suggestion is that we need to stick with the basics. We need to give women education. We need to gather together. We need to do what we did in the past. We need to take our women groups and our churches and our health groups, and we need to bring women together, people together, and we need to educate in small groups. We need to share information within those small groups, and particularly in an age of artificial intelligence, in an age where people are complaining that they feel disconnected and lonely. We need to bring women together where we can support each other in our journeys and we can share information. And so I am saying to our sororities and to our churches, you have health professionals within your groups, within your church. Take advantage of your resources. As Reverend Leon Sullivan used to say, you got to find the diamonds that are in your own backyard. Let's not depend on government. Let's not look to government to give us solutions. Let us feed into our own. Let us develop our own skills and our talents. Let us come together in our communities. Let us be neighbors to each other and share the information. Let's offer solutions that are holistic, that are practical, that are inexpensive, that we can monitor, and that we can improve upon based on the results that we see. This is not radical. This is really old school. And as we move forward into an age where human contact, human interaction may lessen, I'm saying let's not forget the beauty that can be had, the information that can be shared, the healing that can occur when we decide to come together and work together.